Welcome to the Summus Medical Laser Class 4 Laser Therapy Certification Course, Module 3, Laser Therapy Mechanism and Physiology. The objectives of this module are to understand and appreciate the physiological effects of laser, understand the importance of wavelength and pulsing as it applies to laser therapy physiology, and have a general understanding of laser therapy physiology as it applies to everyday clinical practice. And finally, to know how to contact Summus Medical Laser. An introduction to the physiological effects of laser therapy. Chromophores are components of molecules which absorb light. The primary chromophores involved in the process of laser therapy or photobiomodulation are water, hemoglobin, and cytochrome C oxidase. Absorption of laser photons causes photochemical reactions in the cells. The biostimulating effect of photobiomodulation is in its anti-inflammatory, analgesic, and anti-edematous effect on tissues. There is an absolute increase in microcirculation, higher rates of ATP, RNA, and DNA synthesis, and thus better tissue oxygenation and nutrition. There is also increase in the absorption of interstitial fluid, better tissue regeneration and stimulation of the analgesic effect. The three main primary effects that happen with photobiomodulation are pain reduction, inflammation reduction, and enhanced tissue healing. And these effects occur simultaneously. To further break down the physiological effects of photobiomodulation or laser therapy: enhancement of ATP production, decreased C-reactive protein and neopterin levels, acceleration of leukocytic activity, enhanced lymphocytic response, reduction in interleukin-1 levels, enhanced superoxide dismutase levels, vasodilation, increased angiogenesis, temperature modulation, and decreased pain and nociception. Whenever there is a disruption of tissues, inflammation ensues. Inflammation is a response of blood vessels and cells of the injured area that removes intrusive material so that healing can begin. While inflammation has a purpose and a value, it must be kept in check for the healing process to go smoothly. Studies have shown the ability of laser energy to positively influence the concentrations of sodium, calcium, and potassium entering and exiting damaged cells. The proton gradient over the mitochondrial membrane is positively influenced. This is due in part to the formation of reactive oxygen species, which modulate intracellular calcium concentrations, and calcium uptake in the mitochondria improves. ATP production is significantly enhanced through laser therapy, thus contributing to cellular repair and restoration of function. ATP production is significantly enhanced by photobiomodulation. This enhances cell repair and restoration of function, and cytochrome C oxidase is the primary chromophore in the respiratory chain. One method to assess levels of inflammation is the measurement of C-reactive protein, which is increased with the course of inflammation. Neopterin levels, on the other hand, are found in autoimmune disorders such as rheumatoid arthritis and systemic lupus erythematosus. Laser therapy has been shown to lower the serum levels of both these inflammatory markers. Decreased marker levels are indicative that the combined effects of laser therapy induced anti-inflammatory actions are effectively reducing the inflammatory process. So photobiomodulation reduces C-reactive protein and reduces neopterin levels. Beneficial acceleration of leukocytic activity secondary to laser therapy results in enhanced removal of non-viable cellular and tissue components, allowing for a more rapid repair and regeneration process. Inflammation is a defense reaction caused by tissue damage or injury, characterized by redness, heat, swelling, and pain. The primary objective of inflammation is to localize and eradicate the irritant and repair the surrounding tissue. The inflammatory response involves three major stages. First, dilation of capillaries to increase blood flow. Second, microvascular structural changes and escape of plasma proteins from the bloodstream. And third, leukocytic transmigration through the endothelium and accumulation at the site of injury. Laser therapy has been shown to significantly enhance the proliferation response of lymphocytes. Interleukin-1 is a cytokine that is secreted by macrophages, monocytes, and dendritic cells. It is an important part of the inflammatory response of the body against infection. It increases the expression of adhesion factors on endothelial cells to enable transmigration of leukocytes, the cells that fight pathogens, to the sites of infection. The chart shown illustrates the cascade of negative events that occur from increased interleukin-1 levels, resulting in joint inflammation. Laser therapy has been shown to reduce interleukin-1 levels. Laser irradiation has been shown to increase prostaglandin synthesis, particularly in conversion of the prostaglandins PGG2 and PGH2 into prostaglandin PGI2. Laser increases the superoxide dismutase levels, which in turn accelerates the termination of the inflammatory process. Interactions between superoxide dismutase and reactive oxygen species production during laser therapy reduce the free radical activity and allow for the beneficial effects of reactive oxygen species while inhibiting the negative effects of free radical formation. Laser therapy results in enhanced superoxide dismutase levels, which is a powerful antioxidant. Laser has been shown to increase histamine, nitric oxide, and serotonin levels, resulting in reduction of ischemia and improved tissue perfusion. Increased angiogenesis. The formation of new blood vessels in damaged tissue is vital in order to maintain a supply of oxygen and nutrients for repair and regeneration. Both blood capillaries and lymphatic vessels have been shown to undergo significant regeneration in the presence of laser. Laser has been shown to increase nitric oxide levels and growth factors that are contributory to this process. Areas of inflammation typically demonstrate temperature variations, with the inflamed portion having an elevated temperature. Laser has been shown to accelerate temperature normalization. Thermography has been used by some practitioners and researchers to quantify temperature changes at the skin level pre and post laser treatments. Pain is an unpleasant sensation which may be associated with the actual or potential tissue damage and which may have physical and emotional components. According to the International Association for the Study of Pain, we should distinguish between pain and nociception. Nociception is a neurophysiological term and denotes specific activity in nerve pathways. It is the transmission mechanism for physiological pain and does not describe psychological pain. These pathways transmit the nominally painful signals, though they are not always perceived as painful. Although pain can be associated with tissue damage or inflammation, this is often not the case. Because the pain-relieving capabilities of laser therapy are accomplished via the combination of local and systemic actions, utilizing enzymatic, chemical, and physical mechanisms, the process is very complex. This chart outlines some of the major processes and events that are facilitated by laser therapy to help with pain and nociception. Ion channel normalization. Laser therapy rarely exacerbates the inflammatory process and in most cases reduces the time from initiation to full resolution. As such, the immediate introduction of laser therapy post-injury can limit the intensity and duration of the inflammatory process, as well as the disability and pain associated with it. To emphasize, immediate application of laser therapy post-injury is recommended. Increase in beta endorphins. These are pain-relieving endogenous opioid peptide neurotransmitters found in the neurons of both the central and peripheral nervous system. Increase in pain-relieving beta endorphins after laser therapy has been reported in the literature and is another reason to explain how laser therapy can help with pain. Increased nitric oxygen production. Another notable event following laser therapy is an increase in nitric oxide production. Nitric oxide has been shown to have both a direct and indirect impact on pain sensation. Decreased bradykinin levels. Bradykinin is one of a large number of chemical mediators that can activate nociceptors. In addition to activating nociceptors, bradykinin also sensitizes peripheral terminals of primary afferent nociceptors. Sensitization leads to a drop in the threshold for an activation of nociceptors. Several published papers have demonstrated laser therapy's ability to decrease bradykinin levels. Blocked depolarization of C-fiber afferent nerves. This mechanism can be pronounced, especially in low-velocity, unmyelinated nerves, especially those thin afferents from the nociceptors. Normalization of resting action potentials. Researchers have noted a normalization of nerve cell action potentials secondary to laser therapy. Healthy nerve cells tend to rest at negative 70 millivolts and fire or depolarize at about negative 20 millivolts. Compromised nerve receptors in tissues rest at levels closer to the depolarization threshold, meaning higher than the normal resting point of negative 70 millivolts. That means that normal non-noxious activities which create minimal stresses on tissue can easily cause depolarization and produce pain. Laser therapy can help restore the resting action potential within damaged nerve tissue closer to the normal negative 70 millivolt range. Increased release of acetylcholine. This is a neurotransmitter released at autonomic synapses and neuromuscular junctions, and its contribution in the transmission of nerve impulses. As part of this process, researchers have also recorded increased levels of acetylcholine following laser irradiation of tissues. By increasing the available acetylcholine, laser therapy facilitates the normalization of nerve signal transmission in the autonomic, motor, and sensory neural pathways. Axonal sprouting and nerve cell regeneration. Laser therapy accelerates the process of axonal sprouting and nerve regeneration in damaged tissues. This effect may also assist in reducing pain levels. Photobiomodulation, or laser therapy, has been shown to positively impact each of the 4 stages of healing: inflammation, proliferation, remodeling, and maturation. There are increased leukocytic activity, increased macrophage activity, increased fibroblast proliferation, keratinocyte proliferation, increased neovascularization, increased tensile strength, and early epithelialization. Increased leukocytic activity. Beneficial acceleration of leukocytic activity secondary to laser therapy results in enhanced removal of non-viable cellular and tissue components. This allows for more rapid repair and regeneration processes. Increased macrophage activity. Macrophages engulf and then digest cellular debris and pathogens either as stationary or mobile cells and stimulate lymphocytes and other immune cells to respond to pathogens. Laser therapy has been shown in numerous studies to influence macrophage activity in phagocytosis, growth factor secretion, and stimulation of collagen synthesis. Increased neovascularization, aka angiogenesis. This is the physiological process involving the growth of new blood vessels from pre-existing vessels. Laser therapy has been shown to promote revascularization with subsequent improvement in tissue perfusion and oxygenation. Increased fibroblast proliferation. These are cells that make the structural fibers and ground substance for connective tissue. Laser therapy has been shown to increase fibroblast proliferation. Keratinocyte proliferation. The keratinocyte is a major cell type of the epidermis, making up about 90% of epidermal cells. Early epithelialization. An abundance of studies have demonstrated laser-stimulated acceleration of epithelial cell regeneration and its ability to speed up wound healing, minimize scarring, and reduce infection opportunities. These pictures show an actual case that demonstrates laser therapy's ability to accelerate tissue healing and repair. Increased tensile strength. Tensile strength is defined as the force required to pull something, such as rope, wire, or biological tissue, to the point where it breaks. Specifically, the tensile strength of a material is the maximum amount of stress that it can be subjected to before failure. By increasing the amount of collagen production and the concentration of intra- and intermolecular hydrogen bonding between the collagen molecules, laser therapy contributes to improved tensile strength and hence better therapeutic outcomes. The effects of pulsing in low-level light therapy. This slide addresses the different types of delivery of the therapeutic laser light to the patient, whether continuous wave, frequency modulated, or superpulse mode. There are different tissue types when treating the patient. Whatever the pathology or the injury or the body part that we are treating, there are different tissue types which have different cell types. And those different cell types respond to different pulse frequencies, whether it is delivering the laser light in continuous wave mode with a low pulse frequency, a mid-range, or a high pulse frequency. The protocols in your Summus medical laser use a variety of modes of delivery in order to address all of the cell types involved in the pathology of the patient you're treating. There have been studies shown that indicate if you take 2 different cell types and expose them to the same pulse frequency, they show a different behavior. There are also studies that show that if you take the same type of cells and change the pulse frequency, it shows a different behavior. So we do know that applying different rates or different modes of delivery to the patient, the laser light is either in continuous wave or different pulse frequencies, we will get different physiological effects. To summarize those, continuous wave is best at helping to increase blood flow, inducing analgesia, and helping to jumpstart the body. Low pulse frequencies, where that laser light is pulsing between 2 and 100 Hertz, have better effects on low water content tissues, such as bone, cartilage, and ligament, and they are best at producing the physiological effects of analgesia or addressing muscle spasms. Whereas high pulse frequencies, from 500 to 20,000 Hertz, are better at addressing higher water content tissues, such as muscle, and inducing the physiological effects of biostimulation or helping to reduce edema. Once again, your Summus medical laser, with the various protocols built into the software of the machine, employs these concepts to use different modes of delivery to most effectively address the pathology of the condition of the patient that you are treating. To contact Summus Medical Laser, the telephone number is 866-595-7749. Go to our website at summuslaser.com or send an email to support@summuslaser.com or fax us at 615-261-3535. The mailing address is Summus Medical Laser, 1185 West Main Street, Franklin, Tennessee, 37064. Congratulations! You completed Module 3 of the Summus Medical Laser Class 4 Therapeutic Laser Certification course. If you have questions or comments, please contact me at 866-595-7749 or pharrington@summuslaser.com. Now that you've completed the 3 modules, you may take the Class 4 Therapeutic Laser Certification exam. This is a 50-question exam with a 90-minute time limit. You must score 80% or greater to pass. If and when you do, a PDF of your certificate will be emailed to you within 2 business days.